Welcome to Sri Ram Medical College. Today we will explore physiotherapy for children, how it can help your little one grow and develop. Do you think your baby's head is becoming too flat? Is your infant favoring a particular side of the room when they gaze? Is your infant unhappy during tummy time? Is the fact that your kid isn't yet crawling or walking causing you concern? Is it bothersome that your kid has inward-pointing feet when walking or seems clumsy when running? Is your kid experiencing some minor discomfort in his knees or feet whenever he plays football or his other favorite sport? Is your teen's posture a cause for concern? Does your infant have a wheezy or otherwise noisy respiratory pattern? Does your kid have nighttime coughing fits? Does he have a stuffy nose? Is your youngster exhibiting symptoms of asthma? Does your 5-year-old keep you up at night because he or she keeps wetting the bed? Physiotherapists help kids and adults alike keep moving and feeling well. Young patients and their families are the focus of pediatric physiotherapists' daily practice. Although pediatric physiotherapists tend to focus on physical problems, children with cognitive, linguistic, or emotional difficulties may also seek their help. Children's acquisition of motor abilities normally follows a predictable pattern throughout their development, however, individual trajectories are possible. The ways in which children acquire functional skills are affected by factors such as genetics, culture, caregiving, and environmental interactions. A pediatric physiotherapist is trained to treat kids of all ages. When a child is not sitting up, holding their head up, rolling over, crawling, walking, running, jumping, or talking at the typical age, they may be experiencing a developmental delay. No need to panic if your child is developing at a slightly different, or slightly slower, pace than the average child. If your child is developing slowly or has poor muscle tone, problems walking, writing, or tying their shoes, a physiotherapy evaluation may help. Physical and motor skill development in children can be aided by pediatric physiotherapy's focus on routine and individualized exercise. Physiotherapists that work with children are experts in the areas of pediatric growth and development, pediatric disorders, and pediatric diagnosis. Physiotherapy is as important for infants, children, and teens as it is for adults. Most adults, however, feel that children have a greater innate capacity for resilience and quicker healing from injury. The musculoskeletal and neurological systems of youngsters undergo unique stressors as they develop. A pediatric physiotherapist is qualified to evaluate children for physical limitations, as well as identify and diagnose them. Pediatric physiotherapy uses hands-on approaches, exercises, and interventions to enhance muscular tone, strength, coordination, balance, posture, mobility, and range of motion. All therapy decisions consider patients' functional limitations and engagement opportunities using the International Classification of Functioning, Disability, and Health (ICF) model. To this purpose, pediatric physiotherapists provide care as part of a multidisciplinary team, with the child and family as the primary foci. Fine-tuning and reinforcing motor skills is crucial for the development of many children with autism. It's important to treat each child on the spectrum individually, as they all have their own set of challenges and requirements. Along with physical therapy, your child's strategy is customized. Muscular tone, balance, and coordination may be issues for autistic children. Having your child participate in physical therapy is a terrific approach to support their growth and development by supervising their physical activity. A child's potential can be unlocked through pediatric physiotherapy, which involves assessing the child's growth, creating individualized exercises, and providing positive reinforcement. It's also the way to go before and after surgery, which is why it's recommended for kids who need medical attention. In addition to helping children with impairments live more independently and healthily, pediatric physiotherapists are educated to maximize their potential for growth and development. For a pediatric physiotherapy, helping a kid with a physical impairment or disability become as independent as possible is the ultimate goal of their treatment with that child. Physical therapists teach children age-appropriate functional skills, lessen the effects of an impairment, teach them coping mechanisms, and train the family and carer to keep these skills. There has been a recent uptick in the number of cases of neurological disorders among youngsters. Impairments can be transient, permanent, or progressive and can be the result of either inherited or acquired health issues. A child's disability may impact all or some areas of his or her life. The B.VoC approach treats neurodevelopmental issues by improving developmental sequencing, postural control, and sensory inputs to inhibit or activate muscular activity. Beneficial results have been seen when incorporating motor learning into the treatment of newborns with cerebral palsy. Many facets of life are addressed in the highly structured conductive education approach to treatment. The Margaret Rood method is a set of manipulations for activating or suppressing motor activity, involving both superficial and deep stimulation. One such method is the temple fay movement. Patterns that are considered normal are triggered by developmental movements that occur in a specific order. The Domon-Delecto method employs constant, repeating motions of natural sequential developmental movement patterns to activate dormant central nervous system circuits. The Kabat-Zinn method is a proprioceptive neuromuscular facilitation that makes use of functional movement patterns. Physical therapists that focus on continence difficulties often provide urotherapy. Pelvic floor muscle training, neuromodulation, lifestyle adjustments, and behavioral modification are all areas of focus for these therapists who treat bowel and bladder problems. For your child's future success as a person, it's important that he or she develops good motor skills and the capacity to move around. Your child's self-assurance will grow as he or she grows the physical and mental capacity to engage in group play, try new activities, and perhaps try out for a sports team. Your child's strength, agility, and mental growth will all benefit from this. Simultaneously, it facilitates their ability to interact with others and participate in extracurricular activities at school. Instilling a lifelong appreciation for wellness and physical activity in your child will serve him or her well. Most pediatric care settings encourage the physiotherapist to work with other team members. The specific makeup of each team varies according to the requirements of the family and the child. The team usually includes the child, parent/caregiver, and professionals such speech-language pathologists/therapists, occupational therapists, psychologists, social workers, educators, and physicians. B.VoC in Physiotherapy Eligibility Criteria. 12th class from any recognized board. Students, arts, commerce, science, of any age can apply. A minimum score of 50% in the 12th class. Join Shri Ram Medical College's Bachelor of Vocation in Physiotherapy and take the first step toward a successful career in physiotherapy. We are here to assist you in launching your career as a physiotherapist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri Ram Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website shriramcollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.